Have you ever felt like no one really prepared you for the biggest changes in your body? We're told hysterectomy is just surgery. You'll heal, you'll move on. But the reality, too many women walk out of the hospital unprepared. They're dismissed, left with more questions than answers, and sometimes thrown into sudden menopause they didn't even see coming. Today, we're talking about what recovery really looks like, how to rebuild strength, how to face the fear, and how to find confidence again. And don't forget to hit that subscribe button for even more real insights. Dr. Jocelyn Wallace is a doctor of physical therapy who helps women heal and feel strong again after hysterectomy and other pelvic floor surgeries. She blends her medical training with a fitness-forward approach, guiding women step by step back to everyday life. She's also walked this road herself through her own surgeries, and that personal experience shows up in the compassion and clarity she brings to her work. Her message is simple but powerful. Recovery doesn't have to be silence and guesswork. There's a better way. I'm so glad to welcome Dr. Wallace to Real Insights. Hi, Jocelyn. Thank you so much for taking the time and being here today.
Yeah, thank you so much for having me. I'm excited to share with your audience.
Oh, good. Because I've got a lot of questions. And I know that you have dedicated your career to really helping women recover after surgery, like hysterectomy. And for so many women, and especially in midlife, that surgery can feel a little overwhelming. And I know that you have a really particular focus on that specialty, but what pulled you in this direction? And why do you feel that this is such an important piece of women's health?
hmm So I got into working in women's health because my journey with my own uterine health unfortunately started really early in life. I had my first surgery for fibroids when I was 26. So I had large uterine fibroids, which are benign but not still harmful tumors of the uterus. So they're not cancerous, but they do cause a lot of different symptoms. But I had my first open myomectomy, which is like a C-section type incision to remove those from my uterus. And that's the first time I got to see just how little support there was for women's health in general, but especially after these sorts of surgeries that don't involve the perinatal and having a baby time of life. So in getting back to exercise and in getting clarity on how to move through that recovery, there was just nothing out there, no resources. My surgeon couldn't answer my questions with any clarity. And that's when I decided to go into pelvic health. I had already made the decision to be a physical therapist at that time. So I got the specialty certifications and things that you need to practice in pelvic health because that's not something that's included in school. And then along my professional journey, as well simultaneously looking to specialize in working with women, I ended up needing a second open myomectomy, then was lucky enough to conceive my daughter, had a C-section, and then had my fibroids came back postpartum. I had a hysterectomy when she was about to turn 2 years old. And through that whole experience, have just gotten to see again and again and again how little support there is, how little information there is about getting back to things safely after surgery, what a poor job the system does in explaining to people what they might expect to experience after surgery. Is just the support is very much not there. So that's how I ended up over the years of my career so far, building into just supporting women who have gone through all of the major surgeries that don't have anything to do with having a baby.
Why do you feel that recovery care is so limited, and what do you think it should look like?
Yeah, so I think the root of the issue is really just that women's health has been historically underfunded worldwide, but especially in the U.S. The surgeons that are doing these surgeries get paid the same amount of money no matter the complexity of the surgery. So the longest surgery I've seen for hysterectomy, she was under anesthesia for 8.5 hours because it was a very complex hysterectomy alongside excision of endometriosis. She also had an oophorectomy at the same time. So that surgeon got paid the same amount of money as someone whose hysterectomy took an hour. So if there's no incentive for surgeons to get highly specialized at working with women in more complex situations, then we're going to have underserved populations, lack of resources, practices having a hard time keeping their doors open, having to see high patient volumes. It's really a systemic problem that is spilling over into the way that women are treated. And now, in my perfect world, the way that surgery would go is once someone has made the decision to have a hysterectomy, they would have a visit, at least one visit with a pelvic floor therapist before they've even had surgery, so they can in detail go over their personal history, because there are also a wide array of reasons to have a hysterectomy. So someone might be having a hysterectomy for uterine prolapse. Their expectations for what they might go through after surgery are going to be different than someone who, like myself, had it for fibroids. They're two totally different scenarios, even though it's the same surgery. So the surgeons don't have time to go into these nuances, but with a physical therapist, you get to sit down and have a 60-minute, usually one-on-one conversation about your medical history, what's really going on in your life, and they can help you identify what are the things that you can do to help improve maybe your bladder health if there's struggles there, to help avoid worsening urine leaking or incontinence after surgery if that's a struggle for you. They really get to dive into all of those things and get to really understand your history and help you identify the things that you can do to work on. So I think the post-surgery care should start even before surgery.
Yes, and I think you've mentioned in different places that it's almost like training for an event.
Yes. So I often use the
You wanna
analogy
get
of,
ahead of it.
yeah, of you treating it like you're training for a 5K or a marathon or whatever analogy resonates with you, but it's like you're training for something. You want your body to be in the best health possible, which is also something that a physical therapist can help with.
Have you noticed in your work that when you are able to talk to the woman beforehand, like you just said, if you could spend an hour or so with her beforehand, as opposed to the woman who comes to you afterwards, do you notice a difference in the way they respond maybe to aftercare?
Yes, absolutely. I'm the people that end up seeking me out also tend to be very proactive. They're people that are already self-educating quite a bit, which I'm sure affects their results as well. But absolutely, the people that get to work on things before surgery have a much easier time after surgery, not just physically, but also mentally and emotionally. Because when people don't get that kind of nuanced conversation, they're also often left feeling like um, that surgery is just going to be one and done, like 6 weeks go by and then you're just ready, you're back to normal, everything's fine. And that is very often not the case, and it can be so mentally empowering for women to understand that there might still be things that feel different in their body even though they're quote unquote cleared for exercise and normal life and going back to work. But that makes just the mental health side of things so much better for them to have an understanding of what might still be different after having the uterus removed.
And that's really interesting because I think in terms of having surgery, women are just focusing on that physical part of it. Like they know that they're going to go in for surgery and maybe things are going to be removed or that this is what they're going to experience. But I bet that emotional side of it impacts them greatly afterwards.
Yes, absolutely, especially when we get into the hormone side of things and women that have an oophorectomy at the same time and are going into surgical menopause. There are so many different emotional struggles that women go through, and we don't need to add to their plate the emotional struggle of self-comparison because they were told that they're going to be normal and everything will be fine and dandy at 6 weeks, and then they're not. So then they feel like a failure. Then they feel like they did something wrong when it's actually very normal to still feel different when it's 6 weeks post surgery, especially if you're dealing with hormonal issues and especially if you're in the shoes of someone who had the surgery for more severe reasons, like that woman that had an 8.5 hour surgery. You don't go through something like that and feel normal at 6 weeks after surgery.
Can you just explain the difference between, what did you say, an oophorectomy and maybe a
Mhm.
hysterectomy? What are the different types of surgeries that women might be
Yeah.
experiencing?
Absolutely. So hysterectomy just means removal of the uterus, and then there are partial and total. So a partial or subtotal hysterectomy means they leave the cervix intact. So they just remove the uterus and then they leave the cervix there. A total hysterectomy, people often think that means removal of ovaries, but it doesn't. It means they remove the uterus and the cervix. They also often do a salpingectomy alongside that, which means removal of the fallopian tubes. It's incredibly rare for anyone to leave the fallopian tubes and take the uterus. And then oophorectomy means removal of the ovaries. So that is often added alongside a hysterectomy, especially for women who are dealing with cancer. Sometimes it's recommended for women who are already postmenopausal, but there's there's conflict in the industry about whether that is the right thing to do.
Okay. Well, that leads me to many
Yeah.
questions because those all sound like, very complicated terms and so many different scenarios. You mentioned women self-educating. That seems to be a big part of maybe the first steps. Are there any questions that women should be asking, maybe not just not really of themselves, but of the doctors?
Absolutely. So, um, I really should publish a list of just questions that people can take to their appointment. But the first things that come to mind in this moment should absolutely ask about how you can expect the surgery to impact the way you feel hormonally. And a great sort of green flag is when a surgeon acknowledges that yes, research does show that even when people keep their ovaries, that it does affect our hormones. Even if you keep your ovaries like I did, we do tend to go into perimenopause earlier in life. Current research shows about 4 years earlier than we otherwise would have. But it's a great green flag if they acknowledge that, yes, there might be struggles versus sort of scoffing that it's just going to be easy and, you're keeping your ovaries, everything's going to be fine. If they keep it like that and makes it feel like they just want to get the conversation over with, that can be more of a yellow flag. Consider getting another opinion in that situation. And then they should be open to a conversation about your options. So if you ask about keeping your cervix and they just scoff at that, that's a sort of a red flag, warning sign, versus if they have a nuanced conversation with you about this is what I've seen in my practice amongst women who have kept versus had the cervix removed. This is what I see amongst women who've kept their ovaries versus having them removed. Like they should be open to a conversation about both sides, and then apply that information to what they would recommend for you.
Yeah, because I do think it can be a little scary, especially as a woman, when you hear that they're going to be removing your uterus or your ovaries. You identify with, and it probably maybe it sounds strange, I don't know, but we tend to identify with those parts of us that make us feel like a woman or, in our reproductive years. And that can be sort of scary.
Yeah, absolutely. It's absolutely very scary. I can't fathom a world where we removed men's testicles and acted like it wasn't a big deal or called it minimally invasive like they do for hysterectomies. And that can certainly be another big part of the emotional and mental side of things, or those identity struggles that women go through. A lot of people really, really struggle with it. And both ways, too, a lot of women suffer for way too long because of the fear, the understandable fear, but they're so afraid of having their uterus removed that they suffer with the conditions that are making them consider a hysterectomy for decades. Decades. The stories that I've heard of women having fibroids that are now growing up to their diaphragm in their chest and impacting their lung function because they've been so afraid of surgery. So it can really go both ways.
Oh, but it's interesting. Aside from fear, are there other things that you think impact them making those decisions?
Yeah, lack of trust in the medical system, not having access to a surgeon that makes them feel safe, or perhaps they've been to surgical consults and they felt written off, they felt unheard, so then they don't know where else to turn. So that's another a big reason why I think women need to be heard so much better and given so much more, like we need to hold so much more space around the conversations about these surgeries for women, because there there's a lot of decisions not being made because there's so much fear around it and because they're not getting heard.
Based on your own experience, because you've said that you've had multiple surgeries, has there ever been a time where you were like, hey, I don't feel um, that that's right or that I'm being heard. And then you've been able to take that back and to say to other women, look out for, I mean, you mentioned a couple of things, but I guess I
Mhm.
want to know, how did that feel in that moment? Because you know what you're looking for.
Yeah. It felt horrible. My first surgical experience was horrible. I didn't know any better. I just went to the surgeon that was covered by my insurance through the school that I went to, and the whole experience from start to finish was rushed. I wasn't heard. I wasn't given any consideration around what I like wanted to get back to after surgery. I was doing powerlifting and really heavy weightlifting at the time. And it's just kind of like an eye roll, even thinking of having the conversation about wanting to get back to heavy lifting. So that experience was terrible, and I took a lot of lessons from that experience when I was considering my second open myomectomy, I consulted with 5 doctors through that experience, and I only really had a great experience with one, and then the rest were across the spectrum. But I certainly got to see through both of those experiences how different a consultation with a surgeon can be from one place to another, and got to see what a great one looks like. And the same surgeon that did that second open myomectomy did my hysterectomy. So I was able to find a safe space where I felt more than heard. She's amazing.
Well, I'm glad to hear that. I want other women to hear that it's okay to not just go to one doctor, but it might take 5 to
Yes.
find the perfect fit.
Yes. And while we're on the subject, a quicker way, to sort of expedite that is you want to look for a fellowship trained, minimally invasive gynecological surgeon if you're looking for someone who does hysterectomies for reasons like fibroids, excess bleeding, adenomyosis, things like that. So there's a difference between your neighborhood OBGYN who's delivering babies one day, doing pap smears, like kind of bopping back and forth throughout the whole specialty, versus someone who just specializes in surgery. And we have people now that just specialize in these surgeries, and they have much more experience, many more hours under their belt doing these surgeries, and you can expedite the process to a surgeon with more up-to-date training by looking through that lens.
Oh, okay.
And
That is good advice and definitely something, going forward, I hope women hear that to look specifically for those types of doctors because this is a big deal when you're going through it yourself.
yeah, and would you rather have someone that does 20 hysterectomies a month or 2?
Right. Yeah.
Mhm.
I think you just assume that all doctors who are helping female patients do all of these things every single day, and that's not the case.
Mhm. Yeah, they only have so much time in their lives.
You're right. And a little different delivering the babies as opposed to helping women in a different, area
Yeah,
of.
and helping women in midlife, like, you want someone that's gonna hear you if you do have hormonal concerns after surgery, and that could still be 2 different people. It could be an expert surgeon that does the surgery and then an expert menopause specialist that helps with the sort of aftermath of the surgery. It doesn't have to be all with one doctor.
Do you find that even now women are still struggling to get that information or are surprised that after surgery they might be forced into menopause and start experiencing symptoms? Are you finding that women are surprised or are they knowledgeable that that's actually something that could happen?
Yeah. There's still a bucket of women that are surprised. If I had to choose the population that tends to be the most surprised, it's been women who have been reassured that they are solidly postmenopausal and removing their ovaries is not going to impact anything about how they feel. Maybe are already on hormone replacement therapy and are just going to, like, they're just expecting status quo after surgery, and that's not always the case.
Could you give an example of maybe something that women might experience that they weren't aware is going to happen?
A common storyline that can occur sometimes is someone in those shoes that maybe she's been on hormone replacement therapy for 6 years and she's having an oophorectomy and a hysterectomy as well because they found precancerous cells or something like that. So they're removing everything and they're often told just stay on your normal estrogen dose, stay on your regular regimen, you're going to feel fine. And then they start experiencing your classic symptoms of menopause again, hot flashes, signs of estrogen withdrawal, even though they were told, or estrogen declining, even though they were told that everything would be fine. But in reality, their ovaries were still producing at the teeniest bit, an amount that was enough to help keep them feeling well in addition to their hormone therapy. And then the fix there is almost always just to go on a higher dose of whichever hormone therapy they had already chosen. But if they know that up front, it makes a much easier journey than feeling sort of bombarded by it or blindsided by it.
Yes, and I think that's it. I think blindsided is the perfect word to describe how women feel post-surgery and the things
Hmm.
that they start to experience.
Hmm. Yeah, and they often think that the journey was over, and it's not, unfortunately.
Let's talk a little bit then about how you help women feel stronger. Either like you said, you'd almost rather that they come to you beforehand. Um, what are some of the things that you help your patients do to either prepare or feel a lot stronger after surgery?
Yeah, so in my perfect world, I get to know that I'm going to be working with someone before they've even had surgery. And I do offer pre-surgery support, which is getting to have, it's the biggest piece of that is getting to have these nuanced conversations with them. Post-surgery, if someone is starting with me right after, it's a 3-month process. And that is enough time for 95% of women, barring the most complex situations. 3 months is enough time. 6 weeks is not in most situations. So I like to start with people as soon as possible after surgery. If they're able to go for short walks, they're not needing any narcotic pain medications, and they're just able to navigate like their day-to-day home life, then they're ready to start. From a physical perspective, we take a look at how they're moving and what things they're ready to start with from a exercise and rehabilitative perspective, which for most people is going to look like learning how to use their core muscles again, learning how to use their pelvic floor muscles again in a way that is appropriate for their medical history. And then looking at what movement patterns are safe for them to start right after surgery. So a common example is that someone may not be ready to bend over on 2 feet because that's pretty high load and high pressure on the pelvic floor and the healing vaginal cuff and the internal incisions. So we might be working in the first couple weeks. I might be introducing them to the lower pressure ways to bend over and get their day-to-day stuff done. It's like really simple things like that. And then person B might be ready to squat down to pick things up, but not ready to bend over. And someone else might be vice versa. And we determine those things through movement evaluation, where I'm also asking them questions about what they're feeling, or where are they feeling discomforts, where are they feeling pressures, and considering their medical history as well. So if someone, for example, had very severe incontinence, urine leaking before surgery, I'm going to be more conservative with my recommendations to someone like that. So there's a lot of nuance in what someone should or shouldn't do after surgery. So at the beginning, it's really gentle and more about avoiding setbacks. And then as they're working through the 3-month program, as their body starts to heal, we're reintroducing different exercises depending on their ideal activities and what they want to be able to do. We're reintroducing things depending on how their body is showing up. So someone might be ready to start doing upper body exercises before they start squatting. One person with worse pelvic floor issues or worse pelvic floor weakness, it might take them 8 weeks to be ready to do squats again versus someone else, it might take 4 weeks. It's all very customized to the individual, but with a focus on getting them back to full body exercise and their chosen sports, whether they like to run or play pickleball or whatever the thing is. There's different considerations depending on the kinds of activities and lifestyle that somebody lives. But the base of everything is strength training. The best thing that somebody can do after a hysterectomy when their body is ready for it and they're healed enough for it is to strength train, because when we lose the uterus, we do lose some support to the pelvic floor. There are ligaments that hold the uterus that then support the pelvic floor, and it's part of the uterus is part of the support structure, the cervix as well. So when they remove that, we lose a lot of that support. And I like to introduce that fact from a place of empowerment. Like, that can sound scary, and it is a reality that we do lose some support. But just like any other injury, we can rebuild strength through other structures. So if someone had a severe ankle sprain, we're not as scared of it. It's not as vulnerable. It's not a body part where there's so much shame and emotion around it. But our pelvic floor works the same way. We lose support in the ligamentous structures. We can rebuild support in the muscular structures, just like you could after a severe ankle sprain. Even if you tear a ligament in the ankle, you can still rebuild support from the muscular structures. And our pelvis works the same way. So the most important thing that women can do after a hysterectomy is build as much strength as possible in all of the muscle groups that help to support the pelvis, because it's the foundation of everything. And a lot of the conditions and issues that really affect women's quality of life later in life are very much related to the pelvis.
Oh, okay. Well, that's very interesting. So we should probably talk about that. But I just want to say one thing. Women then should probably not get too freaked out about the timeline, because it's going to be different for everyone that you work with.
Yes, it's wildly different. So when someone signs up with me, there's a line in their initial invoice and like their initial paperwork that talks about how their surgery might get moved, and then we'll address that. where that, we expect them to be able to start a week after surgery, but if it's 4 weeks, they start 4 weeks. Like, it's never a rush, and the wildest things can happen. There's so
Oh,
many different
oh yeah.
timelines that can occur.
Life is unpredictable. Okay, well then can we talk a little bit? You just said that the uh, I don't know how the pelvic floor is so important, especially to women as we age. Can you just give me a little bit more on that?
Yeah, absolutely. So, some examples of things that can really affect women later in life that are related to the pelvis are incontinence, urinary frequency. The way that that often shows up later in life is a lot of night wakings that are now affecting sleep. When sleep gets affected and sleep quality gets poor, especially when there's also hormonal chaos going on, sleep quality is poor. Overall health in general gets worse. Metabolic issues get more common. And then more acutely, we worry about falls. So if someone's getting up every 2 hours to urinate, we're of course worried about falls in the middle of the night. That's the most common time that falls and those kinds of issues happen. And then we have the whole sequela of having a fall, hip fractures, hospitalizations, things like that. The other consideration are UTIs. So UTIs are a major cause of morbidity in women later in life, because often hormonal issues are untreated, especially in women who are currently later in life and didn't have access to all of the hormonal information that women of mine and your generation do. But UTIs can often be the start of a cascade into functional decline and worsening health issues, dementia, all of that scary, scary stuff that none of us want to ever have to experience. Um, and then we have the social and emotional and physical impacts of things like prolapse and incontinence. So that leaking that maybe started in your 30s when you first had a baby and wasn't a big deal, only happened when you sneezed a lot. But now you're 65 and now it's getting really bad. And there's a need for, constant use of Depends and those kinds of products. And now it's something that someone has built up 30 years of shame around. And they're afraid to move, they're afraid to exercise, they're not participating in their social life as much as they otherwise would have. And that has enormous impacts on someone's bone health, on someone's physical health and agility, and their likelihood of falls, and their mental and emotional and social health if they don't feel comfortable going out and socializing in the same ways that they otherwise would have. And similarly with prolapse, if prolapse starts to get worse, that can just make people a shell of themselves, not going out and socializing, feeling shame around it, not feeling comfortable standing for even 10 minutes. And then the cascade that has on our physical body and our overall, our balance, our strength, our function,
Mhm.
it's just enormous.
Well, and you don't think about how all these things add up and then do start to affect women, not just physically, but emotionally and mentally, and then they're lonely and isolated. So you're very passionate then about strength training. You feel that that's something that we all should be working on, whether or not we're experiencing have gone through any of these types of surgeries. What about for women who haven't lifted weights since they've lifted the baby out of the crib, or the heaviest thing that they're picking up are the grocery bags from the trunk?
Yeah, yeah. We all have to start where we are, and it doesn't a big narrative that's really popular in the menopause space is this idea that lifting weights means lifting the heaviest thing possible and you need to go to a gym and lift your body weight, or there's another common one that has gone around on social media that you need to be able to do 11 push-ups, or you need to be able to carry 75% of your body weight in your hands and like carry these huge enormous dumbbells. And when I'm talking about strength training, that's not what I mean. Those things are great. That's the kind of thing I like to do for exercise, but you don't need to exercise at that level to avoid hip fractures and falls and all those scary things when we age. The most important initial thing that has to get done is building the identity where you are someone who exercises. And it's not something that you just do seasonally when you have a cruise coming up. It's not something that you just do in spurts, but you are a person who exercises and who puts your physical health as a high priority in your life. And then find your entry point to strength training, whether that's mat Pilates at home and simple body weight exercises, or whether that's going to a group class that sparks your, curiosity, or working one-on-one with a trainer if you feel like you need more intimate support. But the first step is finding that entry point.
How do you feel about helping women build that confidence to do that? Because sometimes we can be a little intimidated by exercise, especially if it's a type of exercise we've never done before. Like maybe we're walkers, or, we used to be a runner, or we've done spin classes, but now we've changed a little bit. And you could sometimes be a little embarrassed, like, oh, I don't mind going to yoga class, but I haven't touched the weights in the gym in forever.
Yeah, yeah. I mean, there's definitely a spectrum, like with anything, as far as the barriers that someone might have to starting, but I always focus on helping someone find their doable starting point. So even if I know that someone is capable of 10 times more than what I'm giving them, if I'm working with an individual, I'm making sure that they feel safe with what they're starting with, that they feel confident in what they're starting with, and they're taking those initial steps, because the foundation of it all is becoming a person who starts to exercise regularly and starts to just pay attention to the strength of their body. And from there, we can build from anything. Like it can be just standing up and down from a chair. It can be learning how to get on and off the floor with more ease, can be strength training. We can start with the foundations of anything, and then also helping to apply it to their life right now can be really powerful. So I often work with people that are afraid to get on and off the floor already when they're 50, and that like they're already having to worry about that, which shouldn't be. We shouldn't be afraid of getting on and off the floor in our 50s. So that might be their strength training at the beginning, is literally walking them through how to do those kinds of things and building piece by piece their confidence in moving their body with more ease.
There's one thing that I love your advice on, and that is that as we age and women find themselves in midlife and they're going through a lot of transitions, menopause, and there's stress at work, and maybe they're caring for parents, and there's an emptiness. There's a lot of stuff that comes at this point in our lives. How do you help women then balance all of that and still take the time, because they might have to have surgery. They might have to take 6 to 8 weeks off and just focus on themselves. Do you find that it takes some convincing to get us to that point?
Yes, absolutely. And it takes a whole lot of unpacking of what exercise means to someone, especially women that grew up in the 80s and 90s, the 70s. There was so much emphasis on exercises for thinness, exercises for changing the way that our body looks. Workouts need to be hard. You need to be sweaty. They need to take an hour. There's so much that is wrapped in our brains of what exercise has to mean. And that really, really, really gets in the way of people taking really powerful actions for their body when they're stuck in the mess of midlife and caring for parents and everything that you mentioned. So there's a lot of flipping the script on what exercise means for somebody, and changing trying to change their minds about why they exercise, and making it more about feeling better with the way that they can show up for those responsibilities, and helping them redefine exercise as like, if you just spend 3 minutes practicing getting on and off the floor, that counts. And convincing people that those kinds of things count. I also often call them movement snacks. But the idea that movement snacks count, that counts as exercise. It doesn't have to be this big, formal, hard, intense workout like it may have been for you in the past.
Right, because we've changed, and even like you mentioned, our schedules have changed. But if you could fit in small movements throughout your day and sort of build on that, is that what you're saying? Kind of use that as a foundation.
Yeah. And build on it and identify. The other thing that can be really powerful is identifying what really matters. Like what really matters that's going to move your physical function forward. So is it your balance? And then helping people identify how will they know when their balance has improved, because those wins along the way of like, oh yeah, that little bit of time I'm putting in day to day is actually making me better. And connecting those dots can really help add fuel to the fire to keep people going.
I just feel that a big part of our journey, especially when there are health concerns, when you're facing surgery and different changes in life, fear can be a big part of that. Fear of pain, maybe fear of now bouncing back or not feeling like ourselves, like what we expect. How do you help women turn that fear into confidence?
That's a big question. I think helping them connect with their shorter term why can really, really help. So a lot of people, like, there will be times that the future crosses their mind and what's life going to look like in 20 years, and they're afraid of whatever the things are that run in their family, but it's really hard to channel that fear into shorter term action. So helping them identify what are the things in their current life that if they were just a little bit easier, they would feel more confident moving about their day to day. So you mentioned caregiving earlier. So how that might show up is maybe they have a family member they're helping to care for, and every time they're done helping with this family member, they feel terrible. Their back hurts. They wake up the next day stiff and in pain. What would it look like if they could wake up in the morning and not feel those
Mhm.
kinds of feelings and not feel so beat up by these current demands of their life? And when they take action on those things and then get to see it actually pay off, the confidence building that can come from that is enormous when they start to see that their efforts are really, really mattering and making a difference.
So it really does come back to that whole, I hear a lot of times women say, oh, you have to put your own oxygen mask on first. It really does
Mhm.
come down to that you need, in order to help somebody else and in order to make your life a little bit easier, you do need to put yourself first sometimes.
Yes, absolutely. And kind of with workouts, putting yourself first doesn't have to mean a spa appointment and a facial and a massage. It can just mean taking 2 minutes to leave the room in a caregiving situation and do a stretch. It can be that simple and that easy to implement on.
So before we leave here today, I'd really love to learn a little bit more about how you work with women, and maybe if somebody is watching and they're concerned about making these types of decisions for themselves, what is something that you would recommend?
hmm so the way that I work with women is really a function of the way that I have to show up in the current system. So because I'm so specialized, I work with people all over the world. So my point being I have to use virtual stuff to be able to
Mhm.
reach people all over the world. So I use a combination of Zoom and then a training app where they have all of their exercises and we have our communication in between our face-to-face sessions. But that's the logistics of it. I would love to see just a worldwide, you know, dozens and if not hundreds of women who do what I do, so everyone had access to an option that worked the best for them. Um, that's kind of the meat and potatoes, like the logistics of how I do this,
Mhm.
so specifically. And then what was the second part of your question? I lost
Um,
it.
just a takeaway.
Mhm.
Like one or two things that you would suggest to a woman who's maybe having to make this type of decision about her health going forward?
Yeah. I would schedule an appointment with a physical therapist. In your area, you can reach out to me, but find someone who has worked with people who have been through this so you get that nuanced conversation if you feel like you're not getting it from your surgeon, and get as many opinions as is realistic for you, to make sure that you feel confident and comfortable in your decision. You don't have to just take the first opinion that's given to you. If someone told you you need to have a hysterectomy, and then get off the support groups. Get off the Facebook support groups that are full of horror stories. Get off of them. If you can find a support group of people who are having more detailed conversations and not just, sharing if it's not just sharing horror stories. So, I am not aware of a support group that I can really, really stand behind and say like there's
Okay.
nothing, scary in here, but I'm sure there's got to be one somewhere. But if you're leaving a support group feeling terrified every time you go and search forums online, keep trying to find one that doesn't make you feel that way because there's a ton of misinformation out
Mm.
there about hysterectomy on the internet. There's still a lot of people saying that exercise isn't safe, that you should never bend or squat again, those kinds of statements. And the evidence couldn't be any further from the truth. The best thing that you can do after hysterectomy is exercise. It doesn't have to happen immediately, but the best thing that you can do after hysterectomy is get stronger.
Well, let's get more women to follow that advice. And with that, how can they find you? What's the best way if they wanted to work with you or they wanted to know more about what you do? So they're not afraid and they're not following strange advice that they
Yeah.
heard on the internet.
I'm the most active on Instagram. My Instagram handle is Dr. Jocelyn Wallace, like Dr. Jocelyn Wallace. I have an email newsletter that someone can sign up for on my website, and my website is just the same. It's just my name.com. But I have a newsletter that people can sign up on, and I have a YouTube that's nowhere near as beautifully organized as yours, but I have a YouTube that has some videos about preparing for surgery and recovering from surgery that kind of go through a lot of these nuances and could really spark a lot of questions and a lot of thought about the more intricacies through about someone's health history and what they might consider for themselves individually. So I'd recommend checking out those videos.
Definitely. And I'll make sure to include those in the description in the show notes. And but I just want to say thank you so much for taking the time and being here today and talking about something where there is a lot of miscommunication. And I think your message is so important and it's so clear and understandable. I hope that going forward, a lot of women will take the time to make themselves stronger and to seek out care when they need it. So thank
Well,
you.
yeah, thank you so much. Thank you for giving me the opportunity to talk to your audience. This was great.
Thank you for joining us on Real Insights. If you want to hear more about how other women find peace in the chaos, order your copy of Empart, Real Stories, Real Wisdom, Real Menopause on Amazon today. And don't forget to join the conversation at joinimpart.com. Until next time, remember that menopause is a journey, but you're not alone.